continue land-breaking or unbelievable research and lengthen the lives of all Americans. My home state of West Virginia, as we have talked, is faced with many complex health challenges. I know that if we work together and make wise investments and focus on what really matters, we can create positive momentum towards eliminating these challenges. Fostering NIH collaboration with smaller and rural states is critical. And one of the strengths of the NIH IDEA program, which many of us are very interested in. This program provides funding to 23 states, including West Virginia, that historically have received little to no federal research funding. The IDEA program and other NIH funding streams have been instrumental for Marshall University, West Virginia University, and other institutions in my state in developing world-class research in neuroscience, cancer, stroke, vision, and addiction science. Researchers throughout my state of West Virginia are making significant contributions to biomedical research in areas ranging from cancers to Alzheimer's disease to substance abuse disorders. I look forward to hosting you in West Virginia soon to see firsthand all the amazing research that is being done across our state. This will be a challenging year for appropriations, yet supporting biomedical research is a priority for me and has long been a bicameral, bipartisan priority for Congress. The United States leads the world in biomedical innovation, and I, along with many of my colleagues on this committee, think it is important that America remains the leader in biomedical innovation and research. Investing in biomedical research has proven to save lives while exponentially strengthening the United States economy. I look forward to hearing from you how this budget request would continue to advance this critical research and innovation. The NIH is a driver of economic growth, funding more than $94.58 billion in national economic activity last year. In my small state, NIH supported over 700 jobs and $147 million in economic activity in 2024 alone. For almost a decade, this committee has supported research towards the goals of finding treatments and a cure for Alzheimer's disease. This goal is very personal to me, as you know, since both of my parents lived with and eventually succumbed to this disease. And I can look out behind you and see in the audience that many folks here are extremely interested in that area of research. These investments have allowed NIH to fund research into a wide variety of potential causes of the disease and build evidence for prevention based on a healthy lifestyle. NIH-funded research on the amyloid protein led to the development of the FDA-approved Alzheimer's drugs that were released in 23 and 24 to slow progression of the disease. All of this research is very important, and I look forward to working with you to continue robust and diversified Alzheimer's disease research. NIH-funded research is also behind many of the more than 600 new cancer treatments that the FDA has approved over the last 20 years. As a lead sponsor of the Childhood Cancer STAR Act with Senator Reid, I look forward to hearing about your priorities and advancements to combat cancer and grow our clinical trial networks, especially among our children. Although we are making positive strides, substance abuse remains an issue in my state. I look forward to hearing more from you about how combining the National Institute of Drug Abuse into a new National Institute on Behavioral Health will enable this important work to continue. I've heard from many university leaders from schools ranging in size, location, and subject about the impact of changes being implemented at NIH. These institutions are the reason that America has kept the edge in biomedical research and innovation. As with many changes in leadership, there seems to be a heightened sense of concern and confusion that diverting resources from research will result in a less healthy America. And I hope today we can work to come to a better understanding. We have a difficult test ahead of us this year, but it is my hope that we will come together just as we have done in prior fiscal years to use our limited resources in the most effective and efficient way to support the health and well-being of all Americans. Dr. Bhattacharya, I look forward to your testimony, and I will now turn to my ranking member, Senator Baldwin, for her opening statement.
Thank you, Chair Capito. Good morning. Over the last few months, this committee has heard from patients, from families, researchers, and experts about what is happening at the National Institutes of Health. It's been one consistent message that this administration is cutting off life-saving research. And if this administration has its way, It will dismantle the U.S. biomedical research enterprise. That would be devastating for millions of American families counting on new life-saving treatments and cures for terrible diseases. NIH makes the United States the global leader in biomedical research and innovation. NIH research contributed to 354 out of 356 drugs approved by the USDA, U.S. Food and Drug Administration, between 2010 to 2019. Simply put, without NIH, there would be no cancer immunotherapy, no overdose reversal medication, no cutting-edge treatments. NIH-funded research has saved millions of lives and significantly reduced death rates from common cancers to rare diseases. It has produced what can only be described as miracles, like last month when American doctors made history with the first successful personalized gene editing treatment in a 9.5-month-old baby boy, curing him of a rare life-threatening genetic disorder. Congress spent nearly 100 years building up NIH as the world's premier biomedical research agency and investing in research infrastructure at thousands of institutions nationwide, which are fueling the development of state-of-the-art treatments that wouldn't have been imaginable just decades ago. But as long as it took to build this, this administration has shown just how fast it can all be torn down. I'm not just talking about the president's catastrophic budget request for next year. I'm talking about what NIH is doing right now. If we don't stop NIH from going down the road it's on, I am deeply concerned it will wreak irreparable harm on biomedical research in this country and millions of American families counting on it. To date, NIH has taken the completely unprecedented step of terminating 2,370 active grants and $4.9 billion in funding. It has significantly delayed the awarding of new grants and continuation grants. It has prevented research institutions from accessing their existing grant funds. Biomedical research can't just be turned on and off on a whim. These delays and terminations aren't just debilitating for scientists, they're also derail research on everything from Alzheimer's disease to cancer to diabetes. Decisions about which medical research grants should be funded or terminated are, for the first time in history, being made by political appointees, most with absolutely zero scientific training or expertise. I'm very concerned about the sudden proliferation of political appointees at NIH and other actions this administration has taken to politicize scientific research, like allowing DOGE to decide which grants get terminated and which grantees actually get paid. Injecting politics into NIH will make American science less rigorous, less credible, and less competitive. Everything that is happening at NIH is being led by political interests, not by science. I want to mention a few examples because details here matter. NIH has delayed $65 million in funding for 14 Alzheimer's disease research centers in 9 states, including at the University of Wisconsin-Madison. It has delayed $47 million in cancer center support grants at 9 cancer centers in 8 states. It has delayed $55 million for 11 rare disease clinical research network grants in 8 states. Let that sink in. This administration is making a conscious choice not to fund research into Alzheimer's disease, cancer, and rare diseases. And NIH has terminated grants for Maternal Morbidity and Mortality Center, a grant developing new digital imaging techniques for cervical cancer screening, and a clinical trial studying a potential cure for infants born with HIV, just to name a few. Many of us have been sounding the alarm about this for months. Through May of this year, NIH awarded 3,288 fewer grants than through the same time period last year. Now the administration's own budget clearly shows this is the plan: to award thousands of fewer grants this year. Each one of those grants represents a contribution to scientific progress, a potential new cure or treatment, or a medical breakthrough that could save millions of lives. And on top of that, this budget proposes to cut $18 billion, or 40%, from NIH next year. That should be all the proof we need to judge this administration's intentions and its priorities. This administration says it will ensure the United States remains the global leader in biomedical research. But its actions and a budget request that would cut the number of grants funded by NIH by 15,000 next year clearly shows those are empty words. This administration cannot be left to its own devices. If Congress doesn't intervene, this administration will tear down our biomedical research enterprise, cede our global leadership to China, and rip away cures that families desperately need for reasons I can't begin to comprehend. That's why I will do all I can to work with my colleagues on both sides of the aisle to protect what Congress has built in this country over nearly 100 years, that has produced miracle cures, saved millions of lives, and given hope to millions more. So I look forward to marking up the fiscal year 2026 appropriation bills in the coming weeks, and most importantly, enacting those bills into law later this year to do exactly that. Because this budget request makes it clear that if we don't, this administration will unilaterally enact policies that will be devastating for millions of American families.
Thank you, Senator Baldwin. And now I turn to our witness. We're very happy to have Dr. Jay Bhattacharya, who is the director of the National Institutes of Health. Welcome.
Thank you. Good morning, Chair Capito, Ranking Member Baldwin, and distinguished members of the committee. I'm Dr. Jay Bhattacharya, Director of the National Institute of Health, our nation's biomedical research agency, and thank you for inviting me to testify on the administration's fiscal year 2026 budget request for the NIH. As both Senator Capito and Senator Baldwin, you've both said, the NIH has long been known as the crown jewel of government and science, and for good reason. NIH researchers and NIH-funded scientists across the country that contributed to life-saving breakthroughs in biology, in medicine. Thanks to our work, the Americans have improved options to control diabetes, have better treatments for heart disease, better treatments for cancer, and major breakthroughs in sickle cell anemia and a whole host of other diseases and conditions that I don't have. If I started to list them, I would take up more than just the 5 minutes I have. Because of the NIH, we can reverse overdoses, we can prevent cervical cancers. The NIH's broad portfolio of investigator-initiated research and the agency's essential role in training the future generations of scientists fuels innovation across the country. It is an absolute honor to lead this incredible agency. Despite this progress, life expectancy in the U.S. has flatlined for more than a decade, since 2012. Millions of children and adults face poor outcomes due to chronic diseases like heart disease, like diabetes, and conditions like cancer and Alzheimer's continue to have a tremendous impact on the lives of millions of Americans. I'm also concerned that after the COVID-19 pandemic, many Americans no longer trust the biomedical enterprise of the NIH. A Pew study in 2024 found that 1 in 4 Americans did not believe that the scientists had the best interest of the public at mind. And as a scientist myself, I find that tremendously concerning. I applaud the NIH's efforts to advance science during a difficult time. However, I take seriously the concerns of the public and recognize the need for reform at the NIH. So, to restore our reputation among the American people and address the chronic disease crisis, we can't return to business as usual. I join President and Secretary Kennedy in their commitment in advancing 21st century research at the NIH. We will build on the agency's record of solving complex challenges and invest resources where they are needed by prioritizing the health needs of the American people, and I mean every single American. We're working to accelerate innovation at the NIH by integrating recent advances in data science and technology with our growing understanding of human biology. We can fundamentally change how research is conducted. We need to empower our nation's scientists to think big and come up with new ideas that will meet the current and future health needs of the country. Catalyzing this shift to newer technologies is more important than ever as research in healthcare yield vast quantities of data. As part of the cross-agency initiative, the NIH is leveraging our large-scale data resources to understand the causes of autism spectrum disorder while respecting patient privacy and security of sensitive health data. I look forward to working with the autism community on this effort. To ensure our innovations make an impact, we must mend our relationships with the public. The American people should have confidence in our findings and trust we are working in their best interest. We've implemented a number of reforms to enhance oversight, transparency, and safety at the NIH. Importantly, we're taking action to improve NIH oversight of funding abroad and to improve the safety and security of biological research. I recognize the value of foreign collaborations and know that many critical breakthroughs have been built as a result of highly productive global partnerships. However, I take seriously the fact that our work is powered by public investment and must be accountable to the taxpayer. That's why we're implementing a new policy that ensures foreign institutions receiving money from the NIH face the same rules for payment and data sharing as the domestic grantees. I understand it's a big change for the research community, but it's critically important. Beginning long before the pandemic, the research community has debated whether the government should fund studies that enhance the ability of a pathogen to cause disease or transmit more efficiently among humans. I strongly believe we should not be supporting these kinds of risky experiments, which constitute only a very small fraction of the NIH portfolio. The NIH is actively identifying and ending dangerous gain-of-function research that could threaten public safety. The scientific debate about gain-of-function research demonstrates the importance of academic freedom. Diversity of opinion is essential in driving scientific progress. Interrogating evidence and challenging the status quo ensures scientific rigor and meaningful results. That's why I'm working to ensure scientists at the NIH can engage in open academic discourse without risk of official interference. It's also important that we solve the reproducibility crisis in research. Reliable, reproducible, generalizable research must serve as a basis for truth in biomedicine. And unfortunately, many research findings have not been reproducible. This is not a moral failure of individuals, but rather a systemic issue that places too much pressure on publishing only favorable results. We're actively exploring ways to reward scientists for cooperating replication, sharing data, and establishing for replication. In closing, I'd like to thank this committee for their generous support of the NIH mission to improve the health and well-being of Americans. I look forward to working with all of you as we chart a path forward for biomedical research to make America healthy again. Thank you, and I look forward to your questions.
Thank you, Doctor. And I'd like to turn to the chair of the committee, who we're very honored to have with us, Senator Collins.
Thank you very much, Senator Capito. Doctor, let me start by welcoming you to the committee. I am well aware that you have devoted your life to medical research, to health economics, and that you care very deeply about NIH. That is why the administration's reduction of more than $19 billion to the agency's budget, that is approximately 40%, is so disturbing. It would undo years of congressional investment in NIH, and it would delay or stop effective treatments and cures from being developed for diseases like Alzheimer's, cancer, type 1 diabetes. I could go on and on. We also risk falling behind China and other countries that are increasing their investment in biomedical research. Let me give a specific example. There are an estimated 7 million Americans living with Alzheimer's today. Barring any major breakthrough to prevent, slow down, or cure this devastating disease, this number could almost double to claim the lives of more than 13 million Americans by the year 2060. And that's why this committee has been so dedicated to increasing the funding for biomedical research and for Alzheimer's in particular to more than $3 billion last year alone. And it's produced results. We've seen the first 2 drugs that have been shown when administered early enough to slow cognitive decline. We have also seen the development of a breakthrough blood test, which will help lead to earlier diagnosis. Yet the administration's budget proposes a decrease of 40% for the National Institute on Aging, which funds most Alzheimer's research. As a senator representing the oldest state in the nation, this is of particular concern to me. And like Senator Capito, I too lost my father to this devastating disease, as well as my grandfather, 2 uncles, and just last year, a brother-in-law. So I know personally what it means to so many American families. Why is the administration proposing to cut the funding for the National Institutes of Aging when we are making progress in treating Alzheimer's and other dementias?
Senator, thank you for the question. And so first, let me just say that I am fully committed to making progress, scientific progress on Alzheimer's. I know all too well from my own research work and from friends and family members the devastating toll of this disease. And we have made tremendous progress. The NIH supports a very wide range of hypotheses on Alzheimer's, and it's resulted in some advances, like, for instance, the blood test for early detection. We still don't have, I think, in my professional opinion, a sufficient way to manage the disease, to prevent the disease and to cure the disease. We need more advances. And so I'm absolutely committed to making sure the NIH plays a tremendous role in that. The president wrote a letter to Michael Kratsios, his science advisor, committing the committing the United States to be the leading nation in the world in biomedicine. And so that's the intention of this administration. The budget. I mean, this is my first time through this budget fight, and so I'm still learning. But I'll tell you, from what I understand is that the budget is a collaborative effort between Congress and the administration. And I look forward to working with you all to advance the needs, the real health needs of not just the folks here in the room who represent Alzheimer's patients, but also the health needs of all Americans. We have tremendous health needs that we have to address. It's only excellent research that's going to solve those problems.
We look forward to working with you to remedy these problems and the deficiencies in the budget. Prior to your confirmation, NIH abruptly and without any notice or input from the scientific community announced a 15% arbitrary cap on research-related costs, also called indirect costs, for institutions that receive grants from the NIH. This proposed cap is so poorly conceived, and I've seen firsthand how harmful it is. It is leading to scientists leaving the United States for opportunities in other countries. It's causing clinical trials to be halted and promising medical research to be abandoned. It's also against federal law. Since 2018, we in Congress have specifically included language to prevent NIH from arbitrarily imposing such a cap. During your confirmation hearing, you committed to working with us on this issue. So I was alarmed and surprised that the administration's budget request contains the same harmful 15% cap. Recently, I met with Dr. Kelvin Drogenmeier, who was President Trump's science advisor during the first term. He has come up with 2 possible models, which are far fairer, make way more sense, increase accountability. Have you had the opportunity to meet with Dr. Drogenmeier and look at the models that he has come up with after extensive consultation?
So I spoke with Dr. Drogemeyer before he started the process, and he told me about those proposals, but in the planning stages. I have not yet met with him after because he had a working group that he put together of experts to think about this. I think that they're quite promising. The key thing first, I can't speak about the 15% because it's subject to litigation, so I'm not going to. I don't want to get into that. But I want to bring the broader policy issue, which is how should the federal government support the research institutions of this country where the research we've been talking about take place. I think it is an opportunity to rethink that. We absolutely have an obligation to make sure that the institutions have the capacity to do the research correctly. Are we doing it fairly? Do we have processes in place that you have the sufficient geographic representation, that scientists across the country, wherever they are, have access? I think we can do a lot better, and I'd love to work with Congress to make to address that. I think there's lots of great possibilities for reform.
Thank you. I encourage you to sit down with Dr. Drogemeyer as soon as you can. Thank you, Madam Chair.
Thank you. Senator Baldwin.
Thank you. As I said in my opening comments, I've been raising the alarm now for months about NIH grant making being significantly behind its normal pace. This year, NIH has awarded nearly $3 billion less compared to the same period last year. That's at least 3,288 fewer grants. So, Dr. Bhattacharya, I want to know who is withholding this funding. Is it you? Is it DOGE? Is it OMB? Who is making those decisions?
Well, Senator, there's a range of decisions that I think that led to some of those pauses of grants.
So who is making those decisions? Not what are the decisions, but who is making them?
Right.
You, DOGE, OMB, someone else?
Because there's a range, there's the different answer for some of those.
Okay, so all of the above?
Well, no, not necessarily. It depends on the specifics we're talking about. So if I may, so there's change in priorities for the NIH to move away from politicized science. I've made those decisions. Decisions regarding, for instance, Harvard and some other institutions, that's joint with the administration, and those are, I believe, temporary after settlements are reached with those universities. And so those are the primary, I think, classes of decisions you're talking about.
Okay. We now have the fiscal year 2026 budget proposal, which shows the plan is to award significantly fewer grants this year and next. OMB Director Vogt recently made a major change on the way that NIH will fund grants. And I want to make sure that the committee is really aware of this because it hides an even deeper cut than the 40% that we're talking about. So for half of its research grants, NIH is going to start forward funding them. In other words, in 1 year, granting a multi-year grant. This is going to have significant impact in the near term on the number of grants NIH awards and how much is spent on research. Your budget requests an $18 billion cut for NIH, and that's bad enough. But be honest with Congress and the American people. This forward funding scheme means that the cuts are even deeper. It means billions will effectively be put in escrow and won't actually be spent on research for a number of years to come. It means that you're effectively cutting research funding next year by another $7 billion on top of the $18 billion cut you propose. And it means that next year NIH would award a fraction of the grants it has historically. Your budget already proposes to award 15,000 fewer research grants next year. And this change alone, this forward funding, accounts for about 4,000 of those. While I think Congress will reject your budget request, it clearly shows the administration's intent. And you can cut $7 billion and dramatically reduce the number of NIH awards next year on your own, unless Congress steps in to stop that. So, Dr. Bhattacharya, I'm struggling to find a reason why NIH would implement this forward funding policy. How is this proposal anything but intentionally sabotaging biomedical research?
So, Senator, a couple of things. So one is regarding funding for this year. Congress allocated the money. My job is to make sure that the money goes to excellent research projects. My intention is that we will spend.
I'm asking about the forward funding proposal that disguises even deeper cuts in the NIH budget than the budget submission would suggest.
Yeah, so I just wanted to preface my answer to that because you asked that also. But regarding forward funding, that's a budget proposal. The policy
you don't deny that
it
reduces the amount that will be spent on biomedical research next year by an even deeper amount than the $18 billion, 40% cut already.
Right. So the way the forward funding works, right now we have multi-year projects that we fund.
Yes.
And forward funding says we will allocate the money for those multi-year projects this year rather than in the out years.
And so
in principle,
if it's a 4-year project, 3 of the years will sit in an escrow account and not be spent next year. Again, further diminishing the amount that will be spent on biomedical research.
No, I think the thing is that in the long run, what it does is allow you to spend more money and have more flexibility for new research projects. That's because what it says.
That's funny math.
It's just the math. I'm an economist also. What it does is it says, look, let's allocate the money this year so that next year the money isn't tied up on previous year's projects. That's in the long run. I think, as I said, I'm happy to work with Congress and looking forward to working with Congress on this. This is a budget proposal, not a final thing. I think if I had to start and redesign the system again from the start, allowing more flexibility as new scientific opportunities come up, the forward funding model allows that to happen actually more than the current model, where large fractions of the NIH budget are tied up with old projects. So I think that, but as the transition it really matters how we do it, and so I absolutely really glad to work with Congress on that to make sure that there's no disruptions.
Thank you. I'm going to save my Alzheimer's question. I think Senator Collins and I have like opinions on that, and very much want to see the innovation in detection, diagnosis, and treatment move forward, and hope that as you're setting the priorities and we set them with you, you know that this is a top priority for many of us who are here, and me in particular. I want to ask about the IDEA program. You mentioned about geographic diversity of research. And we know, and I think the statistics bear out that only a certain amount of states are getting enormous amounts of funding for research and NIH. And some of the middle states, and I'm in the middle state, those of us have difficulty securing research grants and moving forward with it. And that's where the IDEA program really helps. How do you see that when you're looking at the larger picture of priorities? Where do you see the value in that, and how do you think we can make sure that those developmental awards are not just still granted but also increased?
Right. So the IDEAS program is a tremendously important part of how we support research in states and universities that don't traditionally get a lot of NIH money. I was looking up the numbers. I think it's like $440 million in fiscal year 24, which is really a small fraction of the NIH funding. I think from a point of view of science policy, it's absolutely vital that the NIH investments are geographically dispersed. And the main reason for that is the way we combat scientific groupthink is by empowering researchers across the country, no matter where they are, to have a great opportunity if they have great ideas for NIH funding. And the IDEAS program really makes that happen. In my mind, it's less funded than it ought to be, and I actively would love to work with Congress to think of ways so that we can make the NIH investment in scientific research more geographically dispersed than it currently is. It's very concentrated now with I think 20 universities getting about 65% of the money from NIH. The system is set up almost to guarantee that happens.
That continues, yeah.
Yeah.
Thank you. Well, I look forward to working with you on that. Since we're talking about the different geographies, I have learned in the course that if you have a designated cancer center or a cancer National Cancer Institute in and around where you live, your ability to access treatments, your success rate, your early interventions are so much better. And some states are called emerging cancer institutes. One of those happens to be mine. So there are 14 states that don't have an NCI-designated cancer center. I guess my question is, since a lot of it is rural and there's a huge monetary commitment, too, for the universities or the state to be able to create a cancer institute, but this is something that I think is amazingly important to rural parts of this country. How would you close that gap for the underrepresentation in the cancer institutes?
It's very, very important that we expand the NCI's investment in states. It should be national. It should be everywhere, right? I think and it's really important that we collaborate with universities everywhere to make that happen. And that's a major priority of mine. We have, as you say, Senator, it's there's lots of scientific reasons. Like we want to make sure that the cancer trials that we do represent the entirety of the American population, the investments that we make in advancing cancer can't happen without our cooperation with and identification of patients in places we don't traditionally go. I think the NCI has done a really good job in the states that it's in, but we need to do better in expanding expanding these national cancer centers to other states where we haven't been is a major priority of mine.
Thank you. Another priority on my last few seconds that I have is the research, the funded research that's actually occurred under the opioid and addiction research. I mean, this is a growing issue. The statistics have come down, but I don't think we should be taking that as a sign that this is not still a tremendous problem across the country. And Dr. Rezai in our state is using a low-intensity focus ultrasound to restructure the way that the brain reacts to certain stimuli. And so how does your budget prioritize continued investment in addiction treatment?
I mean, Senator, as you know, that the statistics are heartbreaking. Like ever since the pandemic, I think the pandemic fueled a rise in drug overdose deaths, with almost 100,000 Americans a year dying. And last year there was some reduction down to 80,000, but nowhere near pre-pandemic levels. The NIH research has funded big advances. For instance, naloxone, which is used to reverse opioid overdoses, is in part due to NIH research. I think we have a long way to go. It's absolutely vital that we make investments to address this problem that affects the lives of so many Americans and their families. Medical research is going to be a tremendously important part of the solution going forward, and we still need more advances. How do we prevent it? It may, medicine may play an important role in that. And as well as advances in our understanding of the behavioral circumstances that lead to addiction and much else. So absolutely, I'm committed to that.
Thank you. Thank you. Senator Durbin.
Thanks a lot, Madam Chair. And Doctor, welcome. 10 years ago, I made a visit to the NIH, and I met with a man who I believe is an American hero by the name of Francis Collins. He had the job which you currently have. And I asked him what I could do as a member of the Senate to help NIH. In previous years, the number of bipartisan efforts that resulted in doubling its budget, I didn't think that was realistic. And he said to me, what is realistic, and it's hard to do, is give us 5% real growth every single year. If you can do that, we're going to light up the scoreboard. We're making breakthroughs in so many different areas. 5% real growth. Our researchers will know they can count on next year being another good year for medical research. So I came back here and I talked to Patty Murray, who will join us, I'm sure, before this is over. I asked her to join in this effort. Then I reached across the table to Roy Blunt, who was a predecessor as the chair of this committee, and Lamar Alexander, and a number of others who are here today, and said, let's go for 5%. You know what we did? In 10 years, we went from $30 billion at NIH to $48 billion, an $18 billion increase in medical research at NIH. I couldn't have been prouder of all of our bipartisan efforts to do that. This year, your budget wipes it out completely, wipes out $18 billion that we fought for over 10 years. And I can't understand that. I disagree with this administration on so many things, but this is the one that really gets to me personally. To think that this nation would walk away from medical research. For God's sake, we lead the world in medical research. Why would we give up on it? I look at the specifics here. Cancer. 2025, 2 million new cases of cancer will be diagnosed in the United States. 600,000 people will die from that disease. Yet your budget requests a 38% cut, 38% to the National Cancer Institute. 7 million people nationwide are living with Alzheimer's. This disease, of course, is devastating to families. It robs them of their loved ones. Yet your budget requests a 39% cut to the National Institute of Aging. When you look at specific schools, of course, I'm concerned about Illinois. We have great research there. Northwestern University has not received a penny for NIH grants in 11 weeks. 1,359 NIH awards to Northwestern have been frozen or terminated, holding $81 million in research to date. I could go through some of the specifics of this research, but it includes $9 million in clinical trials for brain cancer, colon cancer, breast cancer, childhood cancer. How are you able to reconcile these budget decisions with the reality of research and what it means to alleviate suffering and, more importantly, to give people hope? If research is underway, you at least have the hope that maybe there'll be a cure, maybe in the lifetime of someone I love. How can you walk away from that?
Well, Senator, my intention not to walk away from that. I think that...
But the budget speaks for itself. You cut $18 billion in research.
Well, Senator, the budget is a collaboration between Congress and the administration. So, I look forward to talking about the advances that NIH researchers have made. I think the transition has been a very bumpy time, and I don't mean to downplay that, but there have been opportunities for reform for how the biomedical research enterprise works. I think the decisions about Northwestern happened before I got into office, but let me just say that
buck stops in your office.
I know it does. So let me just say that
don't blame another person.
I'm not blaming anyone.
We're asking you, and you're in charge.
Senator, I agree with that. So let me just say that I think that the way that the universities operated during the pandemic didn't always make it easy for scientists to do their work. I can tell you that personally from being a professor, and I think some of the
but eliminating grants, eliminating research, how can that solve the problem?
So I think that I'm very hopeful that a resolution can be made with the universities where those decisions have been those grants have been paused. I've worked very hard to make sure, for instance, at Harvard, we didn't pause grants, for instance, to the medical centers because there were clinical trials going on. But I think that I'm very hopeful that these universities where these pauses have happened will come to terms so that we can move forward with the agenda that I think you and I both share.
Let me say this. I am personally disappointed. You try as a senator to pick one or two areas and really make a difference. And I think this committee and the members of this committee on both sides made a difference, dramatic difference, 60% increase in NIH research over the last 10 years. You've wiped it out, just wiped it out. And now we start anew. And forget my disappointment, the disappointment of the people sitting behind you who are counting on this research for hope for tomorrow, that life will be better for them and their families. Madam Chair, I'd ask consent that a statement from the ALS Association be entered in the record after my statement.
Without objection.
Thank you.
Senator Moran.
Chairman Capito, thank you very much. Doctor, welcome. Nice to see you again. Thank you for the conversations that we've had prior to this hearing. Doctor, this to perhaps follow on to what Senator Durbin was talking about, the life of a United States Senator, I assume, has lots of glamour and excitement, but I can tell you that perhaps the most satisfying, I say that with a smile because I'm not certain that it's true, but I can say, in all seriousness, one of the places that I found satisfaction in this job, one of the reasons this job has value to me and hopefully to my constituents, is the work that we do in regard to combating diseases and finding the cures and the treatments for Alzheimer's and cancer and diabetes, and the list is ALS, the significant list, and the opportunity then to have a sense of satisfaction that our constituents are actually finding value from what we do. Of probably as all of the arenas in which I work as a United States Senator, this one provides the most satisfaction, and it's one that I can relate to my constituents in which they find satisfaction. There is a lot of skepticism and distrust about government generally, the federal government perhaps in particular, but where there does seem to be satisfaction with what we're doing is in support for finding those cures. And so what task you've taken on is hugely important to me, hugely important, I think, to this committee, and hugely important to the country. And how you make decisions now you have the opportunity to get the satisfaction of that I find at least, in trying to do the things that make a difference in people's lives, individuals, and to provide that hope that Senator Durbin talked about. If Congress, you say this is a collaborative effort, and you're absolutely right, and I encourage Congress to exert its authorities and utilize its responsibilities in this arena and many others. So if Congress were to provide additional dollars above and beyond the President's budget request, how would we as a committee, and how would you as NIH recommend for us to prioritize that spending to get what you're looking for, is in a bit shaking up the past process and system by which grants are awarded and results are attained?
Well, there's a number of ideas that I've had made in my Senate hearing when I was confirmed, as well as in other public things. I think first we have to focus on the real health needs of the American people, and they are enormous. Alzheimer's, yes, heart disease, diabetes, cancer, all of these we need to make, and so many others I don't have time to talk about, need focus and need research and need advances. I also have been heartened by the near bipartisan support that the NIH has long enjoyed, and I hope that we can get back to that. I view that as part of my job, is to say, look, let's have an agency that focuses on things that really matter to people, and as it has, and I think it continues to do. Second, we have to address some of the real problems in science, right? So the replication crisis I've mentioned many times, most people don't know about this, but a lot of scientific research, when independent teams look at the same result, they don't find the same answer. That's basic science. You'd expect there's reasons why that happens. There's no real advantage to doing replication work. That's something the NIH can fix. When drug developers do their own investments, they tell me that they do their own private replication work because they can't trust the biomedical literature. We can fix that as an NIH, and so I'd love to be able to fix that problem. We need to think big. Some of the advances are incremental. Let's focus on thinking big. So I think again, the budget, it's a collaborative effort, but I think it's going to be important that we address the real problems in science and the real needs of the American people with whatever budget that comes out, and that's my job.
Doctor, I think I wrote down what you responded, and among all those words, you said we need focus, research, and advances, and I assume that means need more resources, and that you would put them to good use. Is that accurate?
That's my job, is to make sure that every dollar goes to real science that really meets the health needs of the American people.
Let me ask one final question. Include Project is a trans-NIH research initiative established in 2017. The program is supporting scientists and universities and research institutes across the country, including the University of Kansas Medical Center, where researchers are studying Alzheimer's in people with Down syndrome. I've always been fascinated by this particular aspect of research that combines two things I care greatly about into one in some ways. As the administration advances efforts to unleash science across multiple NIH institutes and centers, I believe Include is a model for those objectives. Will you commit to working with me and the committee to ensure increased federal funding for this effort and maintain the status as an NIH-wide initiative?
I think that's a tremendously important focus. I was recently at an event featuring the advances the NIH made in studying Down syndrome patients. And the early onset of Alzheimer's is one of the major problems that Down syndrome patients face. So I absolutely am committed to that, Senator.
Thank you, sir.
Senator Merkley.
Thank you very much, Madam Chair. And some of my colleagues have already emphasized the work on Alzheimer's. And it's my understanding that no existing grants have been canceled, but some of the advisory council meetings necessary for grants to go forward at some of the 14 or at the 35 Alzheimer's disease research centers have not been held. And so there is kind of an interruption of grant funding.
So, Senator, since I've been in office about 2 months, I've been working to turn on all of the light switches I can find, including getting the committee meetings going. I think we're now caught up. If not, it's very close, and we're on track. I think to support that research.
Well, I really appreciate that and support that. I think you're hearing bipartisan support. Everyone here at this table has friends. Everyone in the audience has friends and family who are affected by Alzheimer's, and certainly it's a terrible way to finish the arc of your life, drifting into a state of malfunction. So I turn on every light switch you can, as you say you're doing. I certainly appreciate that. I wanted to turn to the role of nurses. It's maybe a particular interest in that my wife is a nurse, so I hear a lot about the healthcare system from her point of view and her colleagues' point of view. But you would agree that nurses are a key part of our healthcare system?
Absolutely, yes.
And NIH has engaged in research that is related to the role of nurses, including the impact of patient to nurse staffing ratios. That would be an important area of research?
Yes.
Yeah. You know, one reason I particularly want to highlight that is what I have witnessed in some of the major healthcare systems is that as so many baby boom health practitioners are retiring and so many baby boomers need more health care, the pressure becomes for a higher and higher patient to staff ratio, which then produces burnout, which means that more nurses go on call rather than doing a full work week or retire, accentuating the problem. And so really trying to address the working conditions for nurses is in the interest of keeping more nurses working and therefore have a productive cycle rather than an unproductive cycle. So that research is important. Research also nurses are engaged in interventions that improve the quality of life for many patients, including cancer survivors. Sometimes doctors are a little more on the engineering side, but in terms of the bedside to bedside and follow-up, nurses play a key role. You'd agree with that?
Yes, I would. I mean, I'll just say personally, as a medical student, I learned at least as much from the nurses that I had the privilege to work with as I did from many of the doctors.
So this is why I'm confused about your decision to eliminate, your proposal to eliminate the National Institute of Nursing Research, because such important work is done through that institute. And could you give us a little insight on that? So
I'll just say, again, the restructuring decisions are something that are done in collaboration with Congress. I mean, I looked up the history of this, and Congress has weighed in many times. And there's a process which I'm committed to following to make that in collaboration with Congress. But the substantive question, how should the research that you've outlined and where and should it be done? The key question to me is not the structure of the NIH, but the collaborative nature of the NIH. That research needs to get done because it advances health and well-being of American people. Where exactly it happens is less important to me than that it gets done. And I'm committed to making sure that research like that does get supported.
So essentially what I hear you saying is you put forward a proposal to eliminate the National Institute of Nursing Research, but you understand that restructuring is something that should be done in collaboration with Congress. That actually is the way the Constitution is designed, so I appreciate your making that point. And I'm sure folks here will be very engaged in that conversation. So In terms of any concern that anyone might have, if Congress decides to fund, and the bill is signed by the President, the National Institute of Nursing Research, we don't have to be worried that suddenly those funds will be impounded and it will be shut down.
Senator, a lot of nursing research, including the things you outlined, are important for advancing the health needs of the American people. Understanding the nursing ratios, for instance, that's something I actually studied earlier in my career. So I understand why it's such an important question. So, yeah, I absolutely support that research.
But my question was, if Congress funds it by law, we don't have to worry about the administration shutting it down despite the fact that we have funded it by law.
My job is to make sure that the funds that the Congress allocates for the National Institute of Health are translated into improvements into research that improves the health and well-being of the American people. I'm going to make sure that money is spent, whatever you all allocate to me.
Thank you.
Thank you. Senator Kennedy.
Doctor, you don't look like Satan to me.
I hope not.
Some of my colleagues have accused you of everything but abandoning your children to wolves. Do you hate medical research?
I've devoted my life to medical research, Senator.
Do you hate the NIH?
I love the NIH. I think I said that in my Senate hearing, my earlier Senate hearing. I think it's the most important biomedical institution in the world.
This budget that we're debating today is the president's budget. When's the last time Congress took a president's budget and enacted it?
You know, the funny thing is, I've gotten thanks to this process, I've got to talk with all of you all.
When's the last time that happened?
I can't remember.
It's never happened in the history of ever.
I mean, everyone has strong opinions about what should happen, and Congress gets to have a say, and that's a good thing.
There's some changes that need to be made at the NIH, aren't there?
There are.
Okay. If I'm the president of a university, and I came to you at the NIH and said, I need $10 million to research a cure for nephritis. And I took that $10 million and spent $5 million of it renovating the vice provost home. That would be morally repugnant, wouldn't it? It
would.
If I were a college president and I came to NIH and asked for $20 million to research a cure for dementia, and I took $5 million of that and used it to buy a yacht for my university, that would be morally repugnant, wouldn't it?
That would, and no, that's not.
And that's happened before, hasn't it?
That's not hypothetical, alas.
And there's been a lot of talk about the difference between direct costs, spending the money, for example, on researching cures for nephritis, and indirect costs, overhead. Harvard, for example, with a $53 billion endowment, spends 69% of its money from NIH on overhead, does it not?
I haven't looked at the latest numbers, but it's definitely in that range.
Yale spends 67.5% on overhead, does it not?
Again, roughly in that range, yes.
So all this money spent on overhead is money that's not being spent on medical research, is that right?
Well, it's for fixed costs of like lab space and things, but also sometimes for other things. So it's some of it's absolutely necessary.
Well, if I'm the Gates Foundation, and I came to the NIH and said, I don't want money. I want to give you money. I want to give you $100 billion.
Yeah.
But you can't spend more than 10% on overhead. Would the NIH turn it down?
I wouldn't turn it down, no. In fact, I think that Gates Foundation overhead rates are roughly, again, in that range, 10 to 15%.
The Robert Wood Johnson Foundation limits overhead to 15%, does it not?
That's what I understand, something like that.
Now, I want you to think in terms of the American people and the importance of medical research. What do you think is more important? And we have finite resources. Okay, and I support giving resources to NIH. I think NIH does breathtakingly innovative work. But if you ask American people, would you rather give money to research cerebrovascular disease, or would you rather give $142,000 to the Seattle Children's Hospital to study how to use telehealth to improve access to gender-affirming care? What do you think the American people would say?
Senator, the NIH should be a non-political organization, non-ideological, addressing the health needs of the American people.
But yet, the NIH also spent $120,000 in a grant to, quote, develop 3D avatars that help people work through gender dysphoria, end quote. Did it not?
It did.
And the NIH also spent $2,368,492, gave it to Brown University to study, quote, improving mental health among the LGBTQ community impacted by the COVID-19 pandemic. Did it not?
I think it did. Although I have to say that
Do you think that's more important than studying chronic lower respiratory disease?
I mean, I think we should address the real health needs of Americans, not divide Americans into we have to take into account the real differences in in the biology of people. But when we do that, we should do it in a way that really addresses their actual health needs. Not
I'm running out of time. What we have to do is spend the money on research.
We should. Absolutely.
It's real simple.
I agree with you, Senator, 100%.
And some universities aren't, and NIH is not calling them on it. Isn't it a fact that a study showed between 2017 and 2019, auditors found 137 critical trials funded with taxpayer money involving 41,000 kids, and they didn't even report the results? What happened to the money?
Senator, I think that researchers we support have an obligation to share their data publicly with the American people, no matter what the result.
Otherwise, it's wasted.
Yeah, agree.
All you want to do is fix NIH, don't you?
I do. I want to fix all those problems, Senator.
Thank you, Madam Chair.
Thank you, Senator Kennedy. Senator Britt.
Thank you, Madam Chair. Dr. Bhattacharya, thank you so much for, how do you say it? Say it for me.
I say Bhattacharya, but my cousins think I don't know how to pronounce it.
Okay.
Senator, no worries.
Okay.
Yeah.
Okay. Look, I want to talk about what Senator Kennedy just brought up, but before we do that, I want to talk about one of my top priorities, and that is supporting mothers before, during, and after pregnancy. Look, far too many women in this country are dying from pregnancy-related causes. You look at Alabama, we have one of the highest maternal mortality rates in the nation. It disproportionately affects Black women, Native American women, those women in rural areas. When you look at rural areas in Alabama, we have 1/3 of our state's 67 counties are actually maternal care deserts, meaning they don't have access to birthing facilities or maternal care providers. I mean, look, it's 2025. These numbers should be moving in the opposite direction. I am really proud to have co-sponsored the NIH Improve Act. It's to help make sure that we have research to deal with the things that I just said. My question for you is can you tell us briefly, what do we know today about the why of this is occurring, and where is the gap that we need to close in order to move these numbers in the opposite direction?
I'm sorry, I was just looking at the numbers. I mean, it's a range of conditions, including gestational diabetes, maternal hypertension, a whole host of conditions that are many of which are preventable if we just get prenatal care done early. It's an absolute heartbreaking situation when.
Well, that's another thing. Many women don't even get care until about month 5 of pregnancy. I mean, these are things that we have to change. Look, we are doing this and we're authorizing it and then on a year-by-year basis. It is my thought that if we actually want change, we have to allow for predictability. So my NIH Improve Act allows for 7 years of predictability. My question to you is if that was the case and you had that, do you think that we could have better research?
The answer is absolutely yes.
Okay, great. Well, then I think that we've got to start thinking bigger picture in this body instead of segmenting things one by one. We've got to think, how do we actually achieve the result on the issue in front of us? And speaking of, back to Senator Kennedy's comments, let's talk about about NIH. You know I have been a strong supporter, making sure where we have life-saving and life-changing research that it absolutely continues. I also know that we have to be good stewards of taxpayer dollars. We have to make sure that we create a system where we can continue to be the gold standard of biomedical research across the board. I have heard my colleagues today say and indicate that you want to give up on medical research. Is that true, yes or no?
No.
Right. They have said that you want to wipe out research. Is that true, yes or no?
No.
Okay, so let's have a productive conversation between the two of us right now. When we want NIH to remain the gold standard of research, we've got to make sure that the best idea wins, right?
Absolutely.
We've got to make sure that people have an opportunity to compete no matter where they came from, that we stop rewarding just legacy contracts, so to speak, and empower researchers and empower the research to go where it can save lives. Do you agree with that?
Entirely.
So how do we make sure that every dollar actually goes to discovery and not to institutional overhead? What ideas do you have?
I mean, the key thing there is that we have to make sure that the institutional overhead funds are essentially a part of a competition across universities.
Okay.
Right now, we have a system that guarantees that a very small number of universities are going to get all of the institutional support.
So how do we fix that?
Essentially, the key problem now is that we require the institution to have excellent researchers in order to get the institutional support.
Okay.
It's a vicious cycle because you only attract researchers if you have excellent researchers, if you have the institutional support with the lab space and so on.
So we got to break that cycle.
Have to break that cycle.
How do you do that?
Well, I mean, there's lots of creative ways to do that. The IDEAS program that Senator Capito mentioned is one way to do that. There are other mechanisms to do that. I'd love to talk with and work with Congress on
Absolutely.
how to do that.
I think we've got to create a competitive environment where the best idea wins so that the American people win. We've got to stop churning and churning and churning because it's what we've always done. This is our opportunity to make a dollar go further and to make it have a greater impact. I guess my question to you is if we introduce competition into this arena, which I think is a great idea and a concept that we should explore, if we introduce it into maybe the indirect cost equation, how would that actually bolster, or do you think that would, break the system?
No, I think it would actually strengthen the system because it would get support to researchers that are in non-traditional places but have excellent ideas that have a much harder time getting support from the NIH. And I think that combats scientific groupthink, expands the base of scientific ideas, and it really addresses the critical roadblocks that we currently face.
Well, I hope that you will continue to explore that. We certainly want to be your partner in this. I believe we owe it to the American people to ensure that NIH funding and every single dollar of it is driving actual innovation that achieves results, that makes an impact, that saves lives. And I look forward to continuing this conversation. Thank you for being innovative in how we approach this and working with our colleagues on this committee to modernize the outdated system that rewards legacy and not actual results. Thank you.
Senator.
Thank you. We have been joined by the Vice Chair of the full committee, Senator Murray, and welcome her here.
Thank you very much, Madam Chairman. Welcome to our committee. I am extremely proud of the work that I've done on a bipartisan basis to strengthen our investments in NIH, to support life-saving research, and to really maintain American leadership in biomedical innovation. I'm not going to mince words today about how that progress is now being unraveled. What the Trump administration is doing to NIH right now is, frankly, catastrophic. Over the past few months, this administration has fired and pushed out nearly 5,000 critical employees across NIH, prevented nearly $3 billion in grant funding from being awarded, and terminated nearly 2,500 grants totaling almost $5 billion for life-saving research that is ongoing, that includes clinical trials for HIV and Alzheimer's disease. Across the country, including in my home state of Washington, research institutions have been waiting for months to receive funding for grants they've already been awarded. Meanwhile, NIH is cutting down on grant awards, with thousands of fewer research grants this year and almost 15,000 fewer next year if the administration has its way. Because to pile on this destruction, you and the President are requesting that we now slash NIH budget by 40% or $18 billion. I cannot fathom to what end. The Trump administration is already systematically dismantling the American biomedical research enterprise that is the envy of the world, throwing away billions in economic activity in every one of our states, and jeopardizing the life-saving work of researchers across the country. This budget proposal would effectively forfeit our leadership in research innovation and competitiveness to China. It would mean we depend on China for the latest treatments for devastating diseases. No one in America wants us to do less cancer research. No one is asking you to make it harder to research Alzheimer's disease. And no one is asking you to cut life-saving clinical trials. We are hearing this from the experts themselves. You just received a letter signed by hundreds of your own staff who believe this administration's actions risk breaking NIH and the life-saving work it does. I really hope you heed their warning, and it should go without saying, but I expect none of them to face retaliation for raising those concerns. Everyone on this dais wants NIH to succeed, and you're going to need to see some major changes from what you are doing right now to get us back on the right path. Now, Dr. Bhattacharya, we spoke on the phone last week. I appreciate that. I want to follow up on those questions and what I've been trying to get answers from you for months. You told me 25 staff have been fired from the NIH Clinical Center out of the 1,445 who've been fired across the entire agency. But that does not include staff leaving after being offered buyouts or threatened with future layoffs. I want to know what is the total number of employees who left the clinical center and the entire agency as a result of the Trump administration's personnel actions in total.
So for the numbers I have in front of me are for the reduction in force. That's the 25 I mentioned in our conversation. We'll get those numbers for the retirements to you.
Well, I told you I was going to ask for this administration over the phone. I've requested this multiple times. How come you do not have that for us today?
Yeah, I thought it's my misunderstanding. I thought you were asking for the reduction in force numbers, which we provided.
No, I was being very clear. So I want to know, by the end of the day, can I have a detailed list of the reductions in staff by institute, by center, by job function? Not just the RIFs.
Not just the RIFs. We'll get you those.
Total staff reductions. Can I have that by the end of the day?
Yes.
Okay. Those are really basic questions, and I want to see that by the end of today. Now, I am also particularly concerned, as I told you, about cuts to clinical trials, which are harming patients' care nationwide and the chance for better treatments and cures. NIH has now terminated at least 160 clinical trials. In addition to terminating grants, you are also delaying grant awards and freezing or significantly delaying institutions from being able to draw down their grant funding, which is disrupting clinical trials, to say nothing of the research that it is now threatening. How many clinical trials across the country have been impacted by the grants you have terminated, frozen, or delayed?
Senator, I don't have the numbers for the specific number of trials. We've worked to make sure that the patients enrolled in the clinical trials have any delay in their care as a result of in 2020, the NIH terminated a very large number of clinical trials.
Well, I'm asking you about today, under your
I don't have the
direction.
specific numbers, and a lot of that is subject to negotiation. I've set up a process where people can appeal for if there's any decisions made regarding grant pauses and terminations, and we're actively working to make sure that we can make that appeals process is going. The numbers are in flux, and we'll have to get some of those numbers to you later.
We do know that patient care is being impacted at your own clinical center and in more than 100 clinical trials in the country. On May 30th, you terminated a 23-year research effort to develop an HIV vaccine, just as scientists, including at the Fred Hutch Center in Seattle, are on the cusp of a functional cure for HIV. Terminating those HIV vaccine trials now cuts off access to treatment for 6,000 patients in the network. You canceled a clinical trial evaluating new evidence-based interventions for type 2 diabetes in rural communities in Appalachia. You terminated a clinical trial studying immunotherapy in combination with monoclonal antibodies to treat women with recurrent ovarian cancer. That is what has already happened. So now you are coming to us today proposing to cut NIH funding by 40% next year. Tell us how many fewer clinical trials would you fund in the next fiscal year with a budget cut of $18 billion.
Senator, can I just address the HIV? Because I am absolutely committed to in 2019, President Trump issued a challenge for us to eliminate the threat of HIV in this country. And we've had a 22% reduction in HIV transmission since then. We now have the technological tools to do that. And I've been working on developing a program to actually implement this vision so we can use
But you did
new
terminate
advances.
the HIV research at Fred Hutch that, again, was on the cusp of a treatment for 6,000 patients nationwide. You did do that.
I'd have to get back to you.
You
on
did
that.
do that. Okay.
Senator, I mean, I think we actually have now the chance with the existing technologies, lenacapavir and other technologies, to actually address.
I'm delighted to hear that, but I'm just telling you what clinical trials have been terminated, and I'm asking you this because we have to write an appropriations bill. How many fewer clinical trials will you fund in the next fiscal year with an $18 billion cut?
Well, Senator,
that's your budget request.
The budget request is a work of negotiation between Congress and the administration. President Trump has issued a letter to Secretary Kratsios committing the United States to be the leading nation.
Yeah, okay, well, you're not answering the question. We need to know how many fewer clinical trials. Can you get that number back to me, please?
I mean,
you're asking for a budget. We're trying to figure out what that will fund. That's our job.
The number depends on what the requests we get for proposals from all across the country. The budget itself will be dependent on what you all do as well as what the administration
I know,
does.
but we are trying to write a budget with the knowledge that you have, with the requests that you have. I'm asking a question: how many fewer clinical trials? We need an answer back to that.
Well, Senator, it's hard to give an answer to that because I don't know what the proposals are going to be that are going to come in, right? I mean, you're asking a hypothetical question about what the scientific...
You came here today to ask for a budget that reduces NIH significantly. I would expect as director you would know what the impacts had. We need to know what the impacts are in order to fund that
Senator,
budget.
I mean, it's hard to say exactly what the researchers of the country are going to do in response. I mean, for a hypothetical budget...
Would you say there's going to be more clinical trials under that? Under an $18 billion, 40% cut?
It seems unlikely. But I'll say this, that the budget itself is a negotiation between the administration and Congress. Congress allocates the funds. I am absolutely committed to make sure whatever the allocation goes, that we address the health of the country.
I know my time is way over, Madam Chairman, but I think the point is really important that you are asking us for a significant reduction. It will impact the health of the United States of America. This committee has an obligation to know how you are spending that money. Thank you very much.
Thank you. Senator Rounds.
Thank you, Madam Chair. Dr. Bhattacharya, first of all, I enjoyed our conversation last week. I do think there is a real value in looking at smaller institutions as well and providing an opportunity for them to participate and compete for the grant dollars coming out of NIH. And I think you may very well find that their overhead may be substantially less. I also think, just in terms of being fair, I think we've got to do perhaps a clearer job of understanding as to what would be considered direct or indirect costs and lay that out with regard to whether or not it's overhead or something that's needed. If a smaller institution has the need for a centralized, larger computer system, and that's a larger part of what's considered overhead, it may very well mean that that's a larger part of what they're going to be spending their money on, but it might be a very important part of an experiment. Is that a fair way of looking at it?
Absolutely, Senator.
Okay. Look, I think what you're hearing today is in a number of areas, first of all, that by tradition, a president would suggest a budget and then a Congress would modify it back and forth. What I think we're assuming is that in this particular case, the president's budget has said this is the very basic minimum. Congress, if you're going to authorize stuff, you're also going to be accountable for actually appropriating the money. And so the expectation is, even more than a negotiation, is that we will be expected to put the money where we think it is best. And when we do that with an appropriate authorization, you will follow the law. and you will see that the money is spent in those appropriate locations. But it will be up to us, once again, to reassume the responsibility we've got for actually deciding and telling the American people we want to spend the dollar in the following areas. Is that what you're sharing with this committee today?
Absolutely. It is a negotiation, a cooperation between Congress and the administration for deciding where the research needs of how to best meet the research needs of the country.
I'm convinced that there's an opportunity to do two things at the same time, and sometimes I think it's misunderstood in terms of how we approach spending money, and that is just as an example, in Medicare, 2/3 of all the people that are on Medicare have 2 or more chronic illnesses. We spend 93% of the money in Medicare on those 2/3 of the individuals. They're suffering. Their quality of life is not good with 2 or more chronic illnesses. If we can find a way to improve their quality of life and actually save tax dollars by addressing those chronic illnesses, whether it be diabetes, whether it be Alzheimer's, whether it be Parkinson's, or a cancer, it's kind of a win-win situation, isn't it?
Absolutely, Senator.
I don't think we can do that without integrating AI into this process. And I think we're on the verge of actually doing a lot of that today. But part of it requires databases. Let me work my way through this just a little bit. I think we have to invest in modernized data systems, including leveraging AI to accelerate research, maintain global leadership in life sciences, and develop treatments and cures for both chronic and rare diseases. As a co-chair of the Senate AI caucus, I'm one of the individuals who have championed several pieces of bipartisan legislation. This is bipartisan in nature, to expand AI literacy, adoption, and competitiveness. Now, I've been briefed on the National Center for Advancing Translational Sciences, known as NCATS, and their work on N3C. I'm impressed by its success and its role in supporting the National AI Research, or NAIR pilot. However, under the budget, I noticed that NCATS will be folded into the National Institute of General Medical Sciences. How will NIH's proposed consolidation strengthen NCATS leadership in data science, AI, and machine learning?
So I also am tremendously proud of NCATS and what it's accomplished in AI. I'm also aware of the program you're talking about, where my predecessor, Director Bertinelli, she developed this program. I fully support using NCATS to address the needs you're talking about. To me, the most important thing isn't the exact organization of but rather the actual activities that we do. And under whatever reorganization we do, of course, Congress will have its say. I want to make sure that those activities go forward, because I agree with you, Senator. The investments that we make in AI will pay off dividends enormously. It's a tremendously promising way to do scientific discovery and also to make patient care experiences and physician-doctor relationships much better, and better diagnoses, better ways to manage patients and to prevent illness. I think AI is going to play a real important role in all of that.
I think the next step will be literally incorporating AI as an agentizer in the development of multiple types of approaches to solving lots of these chronic illnesses. And I am very hopeful. This is not something that's going to take decades. It may take years, but this is an opportunity to really show an improvement in quality of life that impacts American families, not just the individuals that have those chronic illnesses, but those who take care of them as well. I look forward to working with you, sir.
Likewise, Senator.
Thank you. Thank you, Madam Chair.
Thank you. Senator Shaheen.
Thank you. Good morning. Nice to have you here, Dr. Bhattacharya. Federally funded research through the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, and the Special Diabetes Program has been really critical in advancing diabetes treatment. We talked about that when you and I met. But NIH funding, your budget slashes NIH funding and potentially guts NIDDK by folding it into other institutes. Even worse, NIH has canceled long-term studies like the Diabetes Prevention Program Outcome Study for both political retribution and supposed cost savings. I have to be very skeptical of using programs within the National Institutes of Health for political retribution. I think it's very damaging to this country. But cutting ongoing trials, I think, doesn't save money. It actually costs money. And it wastes years of prior investments and abandons the patients who have depended on this research. So will you commit today to ensuring that funding for critical diabetes research, including ongoing trials and prevention initiatives, will be prioritized and protected from reductions?
I mean, I commit to supporting excellent research on diabetes, and you and I both share a commitment to that, both for personal reasons. My father died of type 2 diabetes, and also because we've had tremendous advances. Like in type 1 diabetes, we now have a drug that potentially can prevent it for some patients. So I think the continuing research in that area is tremendously important, and I want a portfolio of funding at the NIH that addresses that opportunity and need.
Well, we had this conversation, as you pointed out, and that's why it was so puzzling to me to see what the budget proposes in terms of slashing the funding for NIDDK. So help me understand why that is and how that's going to improve our research into diabetes. And
Senator, I think the budget is a negotiation, a collaboration between the administration and Congress, and you'll have your say. I think for my job is to make sure that the funds that you all appropriate to me go to advancing and meeting the health needs of the American people, and I think that's that's a productive thing. I'm hearing from basically everybody that the NIH is is really valued in Congress, and I find that gratifying. I value the NIH, and so the administration, President Trump has committed that the U.S. be the leading nation in biomedicine in the 21st century, and I entirely support that goal.
Well, I do too, but it's hard to understand how we're going to get there when the budget slashes funding, particularly in critical areas of research, where our most critical competitor, the Chinese, are increasing funding in those areas, and we're slashing the budgets. Another area where I'm very concerned is, and where I think we need more research, is into drug addiction. For years, I've talked with Director Volkov at NIDA about the importance of advancing science on substance use disorders, and finally, in New Hampshire, our overdose death rates are beginning to go down, in large part because of federally funded research on Narcan and other treatments. And yet, it's another place where the budget slashes those investments. So how do you reassure researchers? How do you reassure academic institutions and patients, most importantly, that addiction research is not going to suffer when your budget proposes cutting funding and dismantling the very institute that has led to this critical work?
Well, Senator, the health needs for folks with overdoses are great. Almost 100,000 deaths a year since 2020.
I understand that.
And so
I've been working on it for over 10 years. So don't tell me what the problem is. Tell me what the solution is and how you're going to address it when you're cutting your budget in areas that make a difference.
The solution involves research, right? So as you said, Narcan, that's the result of NIH-funded work. And I don't think it only involves research. The sharp increase in research in biomedicine particularly, but also in behavioral research to understand the sort of settings that lead to overdoses. And I think the NIH is going to play a really important role in that. The key thing is not the reorganization of the NIH. That's not as important to me as the activities that we're talking about. The activities to do research that meet those needs. That's what I'm going to make sure happens at the NIH, so that when if I come back 4 years from now, we can look back and say that we've reached the high water mark of deaths from overdoses, which spiked during the pandemic, and that we've addressed those needs with excellent research.
Well, it's hard for me to understand how we're going to address those needs with excellent research when you're cutting research grants, you're cutting personnel, and we're seeing some of our best scientists talking about going to Europe and to other parts of the world because they don't feel like they can get a fair shake in the United States. Thank you, Madam Chair.
Senator Schatz.
Thank you, Chair. Dr. Bhattacharya, thank you for being here. Good to meet you. I I had a really interesting conversation with Secretary Kennedy, an unexpectedly constructive conversation, because we sort of went through some of the cancellations in his department, and he conceded something that not every cabinet member has conceded, which is that the initial sort of DOGE cuts and terminations and suspensions were at least substantially informed by a Control-F keyword search enterprise. And I've heard this in private with some of the other secretaries, but they kind of concede blunt instrument, like still directionally consistent with the Trump administration's approach, but maybe a little overdone and but it seems to me it's especially bad in the NIH because you can ping some of these keywords and not be talking about anything that's in the least bit ideological. So understanding how chromosomal makeup and cross-sex hormone administration would affect wound healing in mice, the role of environmental sensor, AHR on colitis, establishing the science behind Alzheimer's recruitment registries, opportunities for increasing diversity, and accelerating enrollment into trial. There are probably many, many dozens of these examples where you're pinging a word like maternal or diversity or even trans inside of another word, not to mean transgender. And so I guess what I'd like from you is an admission that was too rough of a cut, and you still have some work to do in untangling, because it's not as though you just sort of say, yeah, that was a little much, and in the next appropriation cycle, we'll clarify what we mean. Many of those grants are currently canceled, and the only thing we're left to do is to go in and petition in some cases, the king, in some cases, part of his court, to say, would you please give mercy to this one? And you're smart enough to know how to run an enterprise. I'm wondering if you would undertake a process to figure out, now that the dust is settled, which ones of these were accidentally ceased, and to try to go about systematically reversing that. I mean, one of the people I talked to said it's going to take 18 months if we go hand by hand. Well, if the cutting takes 2 weeks and the restoring takes 2 years, we're losing a lot. I'm wondering if you can work on that.
Yeah, Senator, I've established a process for appeals for those grant terminations and decisions, and hundreds of people have appealed. It won't take 18 months. It'll take weeks to get through those appeals. We've reversed many of them. I didn't take this job to terminate grants. I took this job to make sure that we do the research that advances the health needs of the American people.
Okay, so give me like a time frame for processing all of them.
I mean, it's hard to promise a specific time frame, but it won't be years. It'll be weeks. I mean, I spent the last couple of weeks, last few weeks. I think it was like a month ago. We set up the appeals process, and they've been working through those numbers, those grant applications.
Can we agree that we shouldn't do it that way again?
I know
you have to survive in this administration, but can we agree that this is not the most helpful way to do things?
I mean, I think a lot of those decisions were made before I got in. I still own those decisions.
Let's keep you out of trouble, and I will come back to you every couple of weeks to see the status of all these. I think it's just a fact that given what happened over the last 90 to 120 days, we're actually losing researchers. It's not like a rhetorical flourish. We're losing people to some friendly countries, Canada and others, and some not so friendly countries, China and others. And I'm just wondering what you would say to a young researcher whose grant just got cut. Tell them why they should stay in the United States, because the prospects, if you are to believe House Republicans, if you are to believe Elon Musk, I'm not sure I can make the argument to a young researcher, you're best staying in the United States. Make the best case. You have a microphone. You're on the record.
Yeah. So the U.S., the World Report, which is a NIH product, estimates how much money public institutions give for research for biomedicine around the whole world. The U.S., through the NIH, is the primary funder of biomedical research. Something like 85% of all worldwide public biomedical research is funded by the NIH. And so if you are a scientist, if you're a young scientist, this is the place to do your work. This is the place where you're most likely to get the scientific resource to do your scientific work. It's the place, if I've actually looked at some...
Sure, I get it in the macro, but if I'm the person whose grant was frozen, I would actually sort of go like, okay, that's like what we did for the last 4 years, telling people that the inflation that they're experiencing is not so bad because look what's happening macroeconomically and how do we compare to these other countries. That's actually not the question. The question is, yeah, what about my situation? I'm a good researcher. I'm being recruited from all these other countries. I would like to do this in the United States. I'm going to not make you answer the question a second time, but I want to flag.
Can I just say one real fast?
Sure. With the chair's indulgence, could I have one more minute?
Do you mind if because this would be.
Yeah, I haven't voted yet, so.
Neither have I. But,
okay.
This is really important to me, so I'm really pleased by the opportunity to answer the question. I have a real commitment to making sure that young researchers get supported by the NIH. They are the future of biomedical research, and I absolutely intend to make sure that happens.
Fine. The last question I have for you, and I'll ask it for the record. There's this conflation of health disparities and different outcomes for the different sexes and people with different ethnicities. You know them better than I do, but certainly as an Ashkenazi Jew, I have to worry about certain things. African Americans have to worry about other things, and so on, right? And that's being swept up as DEI. And I would like you to clarify for the public that there may be a category of things that are more ideological and less scientifically based that we can argue about in some other context. But in the scientific context, it is absolutely true that different people respond to different courses of treatment differently, and that should not be swept up as some sort of like woke enterprise. Can you just agree with that?
Completely agree with that.
Thank you.
Thank you. Thank you, Dr. Bhattacharya. And we have a vote on, so we are going to end the hearing today on that. Everybody's gotten a chance for questions. I'd like to thank you and my fellow committee members for a very thoughtful conversation, and thank you especially for being here. For any senators who wish to ask additional questions for the record will be due June 17th. The hearing record will remain open until then for members who wish to submit additional materials for the record. At this point, the subcommittee will stand in recess, and many thanks to you.
Thanks. Not this year, next year.